Certainly, if we peak in 3 or 4 weeks, it will still take several more weeks before we get to a point where it's on a clear downward path.
And we'll hear much more from Senator Thom Tillis in just a moment.
But first, here are the latest COVID-19 numbers in our state. There are 1,857 cases in North Carolina. State health officials report a total of 16 deaths, 184 people are in the hospital, and more than 28,000 tests have been completed. With a surge of patients expected at hospitals due to COVID-19, North Carolina leaders say they're struggling to get all the supplies they think that they'll need.
Our Capitol reporter Michael Hyland spoke one-on-one with Republican Senator Thom Tillis to find out what's being done to get ready.
Senator Tillis, thank you so much for taking the time to talk to us about how you're responding to the coronavirus outbreak. I want to ask you first, we heard from Governor Cooper about the needs the state has. He says we're getting about 17% of the supplies that we're requesting. Can you tell me what more are you doing to ensure that North Carolina gets what we need? And does the administration need to do more to coordinate all of this?
Well, we're looking at a number of things. Number one, how much of the need is being supplied by the private providers who are ramping up their capability? How much of it's coming from the stockpile? It's my understanding that right now, 25% of the distribution from the stockpile is based on state population. And what we're doing is trying to track to make sure that North Carolina is getting its fair share. I understand while some will be kept in the reserve if we have a hot spot and we have to surge in certain areas, but we're tracking it daily, and we're also trying to determine to what extent the need is now being supplied by the private sector providers through the normal supply chains. And any hot spots, our office is working 7 days a week to make sure that we cover in North Carolina.
The governor and other governors have described this as states competing against each other. Do you think there's anything more the Trump administration could do to stop that?
Well, I think a part of what we have to do is the requests for the supplies are all over the map. You've got, like the state of Florida tended to be more conservative with some of its requirements, and they got their needs met. You've got other states that are making requests that are sometimes 5 and 10 times higher than what we saw in Florida, states with far fewer populations. So what we're working to do is normalize the numbers and make sure that they're going out on a fair basis.
Regarding the economic stabilization bill that you supported, the administration saying people should start seeing that money within 3 weeks. Is that a realistic time frame, do you think?
Yes, I think so. But I tell you, you can help by reporting for those who filed income taxes, for income taxes in 2018, 2019. We should be able to see those checks go out over the next couple of weeks as they mobilize their information systems. But if you didn't, you may still qualify. And what you need to do is go to the IRS website, irs.gov, and file a free form so that we can get you on the IRS's radar. We're also working with people who have Social Security benefits, Social Security disability, to make sure that they're also lined up to get the checks.
Especially if this goes on for weeks and weeks, would you support another round of checks going out to people?
Well, I think the first thing we need to do is mobilize. The last thing I want to do is shift attention away from the $2 trillion we authorized last week. We need to make sure that that gets into households as quickly as possible, that the funding support for businesses so they can make payroll and potentially not lay people off. We've got to focus on that while we're also focusing on flattening the curve. Whether or not we have to do a substantial bill after the phase 3 bill is going to depend upon how high we peak, whether we can flatten the curve.
The president has been accused of downplaying the threat of this for several weeks. Did that cost us time in preparing for this?
Well, I think the president bought us time by doing the travel ban from China, which he was roundly criticized for. No nation should be expected, or no state should be expected to be able to deal with an unprecedented challenge like COVID-19 has forced on us. The real key is being flexible, learn and react to the data that you have.
When you were Speaker of the House here in North Carolina, you had supported cutting back on the number of weeks that people could qualify for unemployment benefits and the total maximum benefit they could get each week. Do you still think that was the right decision?
Well, let me tell you, that decision left North Carolina. When we made that decision, we had a $3 billion debt to the federal government. Now we had nearly a $3 billion surplus. Our state is one of the most prepared to provide benefits to those who need it. The legislature can make a call about a temporary cessation of the duration if we need to. But the only reason we're in that position is because we decided to make sure that we were on sound financial footing. I would also add at the same time, we had no money in the rainy day fund, and now we do. And we made those tough decisions back then so we'd be prepared to provide the support North Carolinians need today.
Your colleague, Senator Burr, has come under some criticism for this sale of some of his stocks over the last several weeks. He's called for a Senate ethics investigation. Do you think that's enough?
Well, I think that the Senate ethics investigation was appropriate. I'm glad Senator Burr called for it. I also would guess or understand that the Department of Justice is looking into it, and we'll wait on them to respond with the facts. But I think that he set that in motion, and then the appropriate regulatory agencies or justice agencies are looking into it as well.
Based on the information you're getting in Washington, what should people reasonably expect going forward in terms of the amount of time that we're going to be under these stay-at-home orders and encouraging this social distancing? At this point, we're not talking about just a few weeks, are we?
Well, the single greatest factor in how long we have to deal with COVID at its current state is what every individual does. They need to heed the advice of their local elected officials, the governor, and what we're hearing from the administration. Social distancing is the most effective way for us to flatten the curve and make sure hospitals are available for those who suffer serious complications. So, you know, it could be weeks. So certainly if we peak in 3 or 4 weeks, it will still take several more weeks before we get to a point where it's on a clear downward path.
Thank you, Senator Tillis, for your time. We really appreciate it.
Thank you.